Beams, y'all. My name is Andrew Defy, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spittin' Quarantino, aka I wear my sunglasses at night indoors because my eyes are as sensitive as my heart is, y'all. And we are back with another episode of the internet's favorite community health live stream. It is episode 41 of Masked Up, and we are talking nutrition. We are going to delve into the science of nutrition, how foods affect our mental health, how racism shows up in the nutritional world, and the new food compass nutrient profiling system that determines how healthy foods actually are for you. We got Dr. May Wang stopping by to serve us up a piping hot plate of nutritional and public health knowledge as we discuss social and environmental factors of diet health and how the pandemic has affected food insecurity here in California. So set the table, polish your silverware, because we're serving dietary education for dinner, and the feast starts now. Millions of Americans are getting COVID vaccine boosters, and demand for them is outpacing the number of first dose recipients. Last week, the CDC announced that boosters may be mixed and matched. With more, here's NBC News.
Pharmacies across the country are now rolling out all 3 boosters after the CDC expanded eligibility to some 70 million Americans. The demand for boosters now outpacing the number of first-dose recipients. Karen Levon got her first 2 shots in January and returned for her Moderna booster Friday.
My dad's 84th birthday is coming up in 2 weeks, and I'd love to be able to see him safely.
The CDC recommends a half dose of Moderna for those most at risk, 6 months after their second shot. For J&J, adults who've been vaccinated for at least 2 months can now get a second shot of their choosing. This week, health regulators signed off on mixing and matching, giving people more flexibility to receive a different shot from their original.
All 3 COVID-19 vaccines authorized in the United States are extraordinarily safe.
Safe, but should you mix and match your vaccines?
If you go into a pharmacy and they don't have the vaccine that you originally got, it really is fine to get a different vaccine.
An NIH study reviewed by the FDA found that all combinations of boosters increase antibodies. The data also showed that volunteers who originally received Moderna or Pfizer shots and swapped third doses saw similar results. For J&J recipients, the study revealed a stronger immune response from a Moderna or Pfizer booster. Some health experts say there are benefits to mixing and matching.
The Johnson & Johnson vaccines and the mRNA vaccines, Moderna and Pfizer, use 2 different technologies. Using different technologies creates antibodies that attack the spike protein of the real virus in different ways and in different places, thus creating a more optimal and a stronger immune response.
A critical scientific breakthrough to beat back the virus.
Kathy, can we expect any side effects with these booster shots?
Jose, doctors say be prepared for side effects similar to what you may have experienced during your last dose of the COVID-19 vaccines. So chills, fever, and fatigue are some of the most common symptoms. Jose?
A new tool has been developed by scientists at the Friedman School of Nutrition, Science, and Policy at Tufts to help consumers, food companies, restaurants, and cafeterias choose and produce healthier foods and help officials to make sound public nutrition policy. The findings of the study were published in the journal Nature Food. Food Compass is a new nutrient profiling system developed over 3 years that incorporates cutting-edge science on how different characteristics of foods positively or negatively impact health. Each food, beverage, or mixed dish receives a final Food Compass score ranging from 1, which is the least healthy, to 100, which is the most healthy. The researchers identified 70 or more as a reasonable score for foods or beverages that should be encouraged. Foods and beverages scoring 31 to 69 should be consumed in moderation, and anything scoring 30 or lower should be consumed minimally. Here's some more.
A new tool has been developed by scientists at the Friedman School of Nutrition Science and Policy at Tufts to help consumers, food companies, restaurants, and cafeterias choose and produce healthier foods and help officials to make sound public nutrition policy. The findings of the study were published in the journal Nature Food. Food Compass is a new nutrient profiling system developed over 3 years that incorporates cutting-edge science on how different characteristics of foods positively or negatively impact health. Important novel features of the system include equally considering healthful versus harmful factors in food. Many existing systems focus on harmful factors. Incorporating cutting-edge science on nutrients, food ingredients, processing characteristics, phytochemicals, and additives. Existing systems focus largely on just a few nutrients. Objectively scoring all foods, beverages, and even mixed dishes and meals using one consistent score. Existing systems subjectively group and score foods differently. The new Food Compass system was developed and then tested using a detailed national database of 8,032 foods and beverages consumed by Americans. It scores 54 different characteristics across 9 domains, representing different health-relevant aspects of food, drinks, and mixed meals, providing for one of the most comprehensive nutrient profiling systems in the world. The characteristics and domains were selected based on nutritional attributes linked to major chronic diseases such as obesity, diabetes, cardiovascular problems, and cancer, as well as the risk of undernutrition, especially for mothers, young children, and the elderly. Food Compass was designed so that additional attributes and scoring could evolve based on future evidence in such areas of gastrointestinal health, immune function, brain health, bone health, and physical and mental performance, as well as considerations of sustainability. Potential uses of Food Compass input: encouraging the food industry to develop healthier foods and reformulate the ingredients in popular processed foods and snacks, providing food purchasing incentives for employees through worksite wellness, healthcare, and nutrition assistance programs, supplying the science for local and national policies such as package labeling, taxation, warning labels, and restrictions on marketing to children, enabling restaurants and school, business, and hospital cafeterias to present healthier food options, informing agricultural trade policy, guiding institutional and individual investors on environmental, social, and corporate governance investment decisions. Each food, beverage, or mixed dish receives a final Food Compass score ranging from 1, that is the least healthy, to 100, which is the most healthy. The researchers identified 70 or more as a reasonable score for foods and beverages that should be encouraged. Foods and beverages scoring 31 to 69 should be consumed in moderation. Anything scoring 30 or lower should be consumed minimally. Across major food categories, the average Food Compass score was 43.2. The lowest scoring category was snacks and sweet desserts, with an average score of 16.4. The highest scoring categories were vegetables, with an average score of 69.1, fruits, with an average score of 73.9, with nearly all raw fruits receiving a score of 100, and legumes, nuts, and seeds, with an average score of 78.6. Among beverages, the average score ranged from 27.6 for sugar-sweetened sodas and energy drinks to 67 for 100% fruit or vegetable juices. Starchy vegetables scored an average of 43.2. The average score for beef was 24.9, for poultry 42.67, and for seafood 67. Food Compass is the first major nutrient profiling system to use consistent scoring across diverse food groups, which is especially important for mixed dishes. For example, in the case of pizza, many other systems have separate scoring algorithms for the wheat, meat, and cheese, but not the finished product itself. Consistent scoring of diverse items can also be helpful in assessing and comparing combination of food and beverages that could be sold and consumed together, such as an entire shopping basket, a person's daily diet pattern, or a portfolio of foods sold by a particular company.
So we know racism shows up everywhere, and the nutritional field is no different. From Black and brown neighborhoods being more likely to be food deserts to not including Black and brown folks in dietary studies to determine health recommendations. Food justice is a growing movement and is changing a lot of people's lives. Here's one of those stories.
The world has got to change. I lived in a community that was so prosperous with doctors and lawyers and politicians. Now we have drug dealers and corner stores that they don't sell anything but the wrong things. You cannot deny the impact that it has on people's health. I have been in West Baltimore my entire life. As far as money, my mother didn't have any money. I don't want to say she was poor, I'll say low income. Poor we were though. In the 50s, we didn't have many choices as far as healthcare. The healthcare system then was limited. It was not good for us. And medicine costing so much that my family says sometimes, will I eat or will I pay for my medicine?
Which one do you want?
Oh, I just love my daughters when they come over and we get together and we cook and prepare meals together. It's healthy meals. When my oldest went to college, she came back with a different diet.
Now what happens is if I do a meatloaf, it's turkey instead of ground beef. You know, I make spaghetti, I make chili, stuff like that. It's with turkey and chicken. We grew up, we ate pork. We ate bacon, we ate a fresh shoulder, we ate pork chops. I did not think it was not healthy eating, right? Because this is what we were accustomed to. I was in denial. I didn't want to face the fact that I was becoming a diabetic.
The impact is the fact that my family ended up with heart disease, emphysema, diabetes, cancer. My mother's sister, her daughter died of diabetes. She was an amputee. My mother died of a massive heart attack. And
to address health disparities, we need to understand why they exist, that they're not due to one single factor. They're the result of policy decisions we make as a society. They're due to the environment, health education, insurance and access to care, access to healthy food, and stress. Those stresses are actually experienced disproportionately by people who are poor and people who have been historically disadvantaged in this society.
Solutions to these problems cannot just be medical, it's systemic. And that means everybody has to get involved.
If we want a nation to be strong, the people in that nation have to be healthy. They have to be well. If there's anything that we can do to stamp out disparities, we need to do it by any means necessary.
Hi, Ms. Simmons.
Here at East Baltimore Medical Center, most of the patients are underserved.
We need nice deep breaths in and out through your mouth.
Michelle is a terrific success story. There was actually a year where she had lost her job, and before she found a new one, she had no health insurance. And she still managed to buy her medicines out of pocket, paid out of pocket to come and have doctor visits. She was really invested in her own health. That's something that Dr. Cooper's research is looking at, why patients don't invest in their health like we wish they would.
The next thing on the agenda is the community update. So I'm going to turn.
Michelle joined our community advisory board in 2011. We provide education to the community about health and about research. We offer training programs for community health workers. We can be sure that we are meeting the needs of people appropriately and that we're not leaving out certain groups of people that have traditionally not been included in conversations related to health and healthcare. Our strong relationship with the community is just essential. There's no way that we could do what we're doing without their input. And my work is just one of many initiatives here at Hopkins.
Good to see you too.
Ms. Simmons is a great example of what happens when we get it right as clinicians and as an institution.
I am a fighter. I am a believer. I stand for what's right. And what's right is people's health. And I will never give up as long as I have breath in my body.
One of the things that is so important is that people have what I call a liberated future. And it's hard to be liberated when you're not healthy. When I say liberated, I mean freedom to be all that God meant for you to be. When we don't deal with disparities, then what we're doing is denying people an opportunity to give back to the world. So we've got to fight it. We've got to fight it with everything we've got.
Our guest tonight is an associate professor at UCLA Fielding School of Public Health. She has a master's degree in nutritional science and both a master's and doctorate degree in public health. After obtaining her doctorate degree, she completed a postdoctoral fellowship at Stanford University School of Medicine, where she was trained in the emerging field of pediatric bone health research. Since then, she has conducted research related to child obesity and bone health with a focus on addressing health disparities. Y'all, welcome Dr. May Wang to the show. Dr. May Wang, how are you doing tonight?
I'm doing great. Thank you.
We are so excited to have you here on the show and talk a little bit about the intersection of nutrition and health and how they kind of relate. Now, you have a number of degrees in both nutritional science and public health. What inspired you to pursue a career in the intersection of nutrition and public health?
Oh, I wish I had a more inspiring answer, but the truth is I grew up in Singapore and I always wanted somehow to be a social worker, actually. But the education system there was such that we were streamed into the hard sciences at a very early age, like around 14. And so it sounds a little bit odd, but I was kind of scared to get into the social sciences because I was so much into the hard sciences. So I studied nutrition science with the idea that maybe I could move into something called community nutrition. That sounded good, but I frankly didn't know what it was. And I came to the US to study that. And then I literally fell in love with it. And I've been moving more and more into the social science side over the years, and feeling really blessed that I've had this opportunity to be on this journey.
So a lot of your research centers around social and environmental factors and how they're related to diet-related health conditions. Can you talk to us about why there's a link between nutrition and social and environmental factors?
There's a huge link there. I think when you talk about nutrition, I'm assuming you're thinking about, the nutrition of what people eat, right? And well, what people eat, yes, knowledge is a big thing. That's what people are always thinking about. Education, we're going to teach people to eat healthy. And, frankly, we've actually done pretty well in that regard. And when we do assessments, people know what to eat, but they just can't change their behavior. And about in the early 1990s, started with a couple of studies in the UK, and we followed up in the US, where we found that the nutritional quality of the diets of people varied by neighborhood, by where they lived. And so we started doing more research, and we realized food excess is a huge issue. So it's not so much that people don't want to eat healthy, is because the kinds of healthy foods are not readily accessible. And by accessible, I mean not just that they're not physically accessible, which is a problem. We have food deserts and food swamps, but also that they're, the healthier foods like fresh produce are actually really not cheap in this country. And what is cheap is the other side of the equation, is that what is cheap and affordable is a lot of the processed fast food.
Right.
It sounds almost like a paradox in some ways, like you have to process it, put so much labor into it, and then it's actually cheaper. But the economists can tell you this has to do a lot with supply and demand and pricing and all of that. And so because in many of the poor neighborhoods, what we're seeing is more of, convenience stores, smaller markets that don't carry the fresh produce. And part of it is also what we've been hearing. It's more expensive, right? You have to have refrigeration. It's harder to get the fresh produce. So the non-perishable foods, the processed food, the fast food is all readily available, and it's cheaper. And what is bad about processed food? I mean, that's a question people always ask. If you've eaten a fresh apple or anything that you've just plucked off a tree, and something that's been sitting in the supermarket for a long time, you know the difference in taste. right? And I think we know that when you process food and make it non-perishable, you've got to enhance the flavor so people are not going to eat it. And the way we enhance it is through the flavor enhancers, fat, sugar, and salt. And those are the things that we know increase your risk for all kinds of chronic diseases.
Absolutely. So you recently published a paper about the pandemic's impact on food insecurity in California and how it has especially affected low-income communities. Can you tell us a little bit more about this study and what we can do to address these disparities in food access?
Sure, I'd be happy to. I think early in the pandemic, a colleague of mine, Dr. Evie Blumenberg from Urban Planning at UCLA, and we decided to get together to try to analyze data from the Census Bureau's Household Pulse survey. So this was a survey that the Census Bureau put together to try to see how the pandemic was affecting people. And it asked one question about food excess, insecurity, insufficiency, really. It was a very simple question about whether people were getting enough food during those early months. And they actually continued with that survey. But we analyzed data only for the months of April to July. And what we saw was actually, some of it was was pretty expected. We saw a higher rate of food insufficiency among those who were food insufficient before the pandemic. Nothing surprising there. We saw higher rates among ethnic minorities. And then, of course, folks who were of lower socioeconomic status, that was not surprising. Folks who lost their jobs, you saw high rates of food insufficiency. But what I think we saw that was maybe surprising and interesting was when you look at the food insufficiency rates between Northern California and Southern California. Sorry, I forgot one important point about the study. We were looking at regional differences between 3 different metropolitan statistical areas, or 3 different regions, San Francisco Bay Area, and then Los Angeles, Anaheim, and then Riverside and San Bernardino. Those were the 3 areas we looked at. And yes, we had higher rates of food insufficiency in Southern California. Poverty rates are higher. But what we didn't expect to see was that in Northern California, among those who were disadvantaged, we saw higher rates in Northern California. And so the big question is, what is happening there? We're trying to do more studies. I can, kind of speculate a little bit. I think it may partly have to do with the outreach of CalFresh, or the SNAP program, used to be known as the food stamp program. The participation rates in Northern California, and that participation rate is the number of eligible people who actually participate in the program. They're much lower in many of the counties in the Bay Area. San Mateo, I think, had a participation rate of, if I remember, about 37% in 2018. So I think what this suggests to us is that we really need to find a way to, increase participation rates in these safety net programs, so that when something big like the pandemic hit, people are ready. These programs are ready to be helping those in greatest need.
Absolutely. And a lot of these programs, like you said, many people do not enroll in them. Can you elaborate a little bit? Like, why is it that people aren't enrolling, and what measures can be taken to increase enrollment? What can we do to kind of get people a little more aware of some of the resources that are out there?
The first question is probably a little bit easier to answer. A few studies have been done. I think one of my good friends, Dr. Loan Kim at Pepperdine, she did a small study of Asian American Pacific Islanders in SoCal. And what she found was things like shame and pride, the stigma attached to it, but also the lack of knowledge. And also for many non-English speaking immigrant communities, it is difficult for them to apply for this program. Now, having said that, I want to give some credit. The Department of Social Services, they have supported an effort for online application that is called getcalfresh.org. and they have it in English, Spanish, and Chinese at the moment. And I think they're trying to, have it available in different languages. But even so, it is sometimes hard for people to access applications online. And what I've heard anecdotally is sometimes people are afraid to upload their personal information to the internet, right? So the community-based organizations, really hold people's hands to try to get through that whole process. And so that's the application process, and I think has also been a barrier. Now, having said that, there has been a lot of effort to try to simplify the process. USDA now has a pilot program. I think it's called ESAP. I forget what it stands for. Easier. I'm sorry. Anyway, it's a program to try to get states to come up with an easier application process for SNAP. So hopefully, we can streamline that process better, and together with increased outreach activities, we might be able to get more people enrolled in this program.
Absolutely. Thank you so much, Dr. Wang. I have one last question for you, and it is the question that I ask everyone who comes on this show, because we hunt joy here. Where are you finding your joy today?
Today, I love my walks, and that's exactly what I'm going to be doing right after this. So thank you so much.
Absolutely. Thank you so much for joining us, and just continued success in your efforts. And we appreciate you coming through.
Thank you. Appreciate it too.
As we close out the show tonight, we know that health is more than just physical. It is also mental. So we wanted to talk about how the food you put in your mouth can affect the chemicals going to your brain. Check out this TED piece on diet and mental health.
If you sucked all of the moisture out of your brain and broke it down to its constituent nutritional content, what would it look like? Most of the weight of your dehydrated brain would come from fats, also known as lipids. In the remaining brain matter, you would find proteins and amino acids, traces of micronutrients, and glucose. The brain is, of course, more than just the sum of its nutritional parts, but each component does have a distinct impact on functioning, development, mood, and energy. So that post-lunch apathy or late-night alertness you might be feeling, well, that could simply be the effects of food on your brain. Of the fats in your brain, the superstars are omegas 3 and 6. These essential fatty acids, which have been linked to preventing degenerative brain conditions, must come from our diets. So eating omega-rich foods like nuts, seeds, and fatty fish is crucial to the creation and maintenance of cell membranes. And while omegas are good fats for your brain, long-term consumption of other fats, like trans and saturated fats, may compromise brain health. Meanwhile, proteins and amino acids, the building block nutrients of growth and development, manipulate how we feel and behave. Amino acids contain the precursors to neurotransmitters, the chemical messengers that carry signals between neurons, affecting things like mood, sleep, attentiveness, and weight. They're one of the reasons we might feel calm after eating a large plate of pasta, or more alert after a protein-rich meal. The complex combinations of compounds in food can stimulate brain cells to release mood-altering norepinephrine, dopamine, and serotonin. But getting to your brain cells is tricky, and amino acids have to compete for limited access. A diet with a range of foods helps maintain a balanced combination of brain messengers and keeps your mood from getting skewed in one direction or the other. Like the other organs in our bodies, our brains also benefit from a steady supply of micronutrients. Antioxidants in fruits and vegetables strengthen the brain to fight off free radicals that destroy brain cells. enabling your brain to work well for a longer period of time. And without powerful micronutrients like the vitamins B6, B12, and folic acid, our brains would be susceptible to brain disease and mental decline. Trace amounts of the minerals iron, copper, zinc, and sodium are also fundamental to brain health and early cognitive development. In order for the brain to efficiently transform and synthesize these valuable nutrients, it needs fuel, and lots of it. While the human brain only makes up about 2% of our body weight, it uses up to 20% of our energy resources. Most of this energy comes from carbohydrates that our body digests into glucose or blood sugar. The frontal lobes are so sensitive to drops in glucose, in fact, that a change in mental function is one of the primary signals of nutrient deficiency. Assuming that we are getting glucose regularly, how does the specific type of carbohydrates we eat affect our brains? Carbs come in 3 forms: starch, sugar, and fiber. While on most nutrition labels, they are all lumped into one total carb count, the ratio of the sugar and fiber subgroups to the whole amount affect how the body and brain respond. A high glycemic food, like white bread, causes a rapid release of glucose into the blood, and then comes the dip. Blood sugar shoots down, and with it, our attention span and mood. On the other hand, oats, grains, and legumes have slower glucose release, enabling a steadier level of attentiveness. For sustained brain power, opting for a varied diet of nutrient-rich foods is critical. When it comes to what you bite, chew, and swallow, your choices have a direct and long-lasting effect on the most powerful organ in your body.
And that brings us to the end of episode 41 of Masked Up. The anniversary of this show popped up last week, and it feels like it hasn't been a year, as well as feeling like it's been 41 of them. It's been a wild ride, but it's been an incredible honor to host this show and work alongside the incredible people I get to bring the health news that matters to your feed. I'm really thankful that y'all have tuned in and kept tuning in, and I hope you learned as much as I have. I love you. I'm glad you're here, and I appreciate you. Now, for the rest of the Masked Up team, like we always do at this time, health is wealth. Get your bag.